Hello, four-year CNA fans, and welcome to today's episode. Today we're going to be speaking with ShaNiqua, who works at a walk-in clinic, and she's going to tell us all about what life is like as a CNA in that setting. I'm your host, Miss Patty, and thanks for tuning in. Hi, ShaNiqua.
Hello.
How are you today?
I'm good. How are you?
Wonderful, wonderful. What role do you play in healthcare? What is your title?
My title right now is a CNA at a local hospital, and then also I am an X-Ray Tech at urgent care.
How fascinating. Very good. So you work in two different settings.
Different settings.
All right, so you've got a lot of really good experience then. So let's kind of look at each one of these a little bit individually. How long have you been a CNA?
I have been a CNA, I would say about a year. I was a home health aide previously.
All right. And how long have you been an X-Ray Tech?
I would say about a year and a half.
So as a CNA in the hospital, what floor do you work on?
PCU.
PCU. So what kind of things would you do in the progressive care unit?
I would make sure that everyone is correctly hooked to their monitors.
Okay.
Because everybody on that floor has monitors, heart monitors. And then you will also answer lights to see if the patient needs a drink of water or to be changed, or hourly rounding with positioning them, or you would say if they need a snack, you would give them a snack. If they need the nurse, you can let the nurse know that they need their medications or whatever it may be that the nurse can handle other than the CNA.
Okay, so your main job is just to make sure that the patient's needs really are being met.
Yes.
Whether it's toileting or water or snack or turning and repositioning.
Yes.
So how long have you been working in the hospital?
Only a couple months.
And you also work at a walk-in clinic as well. So what are some things that you would do in the walk-in clinic setting?
I would, because currently I'm doing back office, so I would triage the patient, take their vitals, and I also do that in CNA. I forgot to say that. You take the vitals, then I record them in the system, and then I'll put them in a room for the provider to go see.
Okay, all right, so there's a lot of similarity in what you do in both settings, where the hospital, you're taking vitals, and the walk-in clinic as well, but there's some differences there as well.
Yes.
So what are the types of patients that you would see in a walk-in clinic versus what you're seeing in a hospital setting?
In a hospital setting, I would see people that really got really health issues that need to be watched and monitored and make sure they get well.
Okay.
And then in the walk-in clinic, it's something like a common cold or like a little rash or something like that that we can kind of get under control right away with some antibiotics or some medications that they can just take within a week and be okay.
So the walk-in clinic, your patients aren't quite as sick.
Yeah, not quite as sick.
Right. As an X-ray tech, what are some things that you do in that, for that type of job?
Okay, for our X-ray tech, say if a patient come in the clinic with a sprained ankle or they had trauma to this ankle, I would also do the vitals, take them back to the room, let the provider assess them, and then I will go position them in the X-ray room as needed, and I will take the X-ray. And then I will send it out for the reading. So
the X-ray tech is a little bit different type of medical care.
Yes.
Where you have to know a little bit more anatomy and physiology, yes, and the different positions that you need to get the patient into so you can see, yes, what the provider needs to see. So do you find that that's a little bit more technical work?
Maybe so. Like you do have to know what you're looking for. Like you have to, just like you said, you have to know the anatomy of the body in order to even position that person to even take the X-ray of what you're trying to see.
Okay. Now, are the X-ray machines difficult to learn how to work?
You have to know what's behind it.
Okay.
So it's not hard to work but you have to know how the machine works.
Just being able to push a button is not really what X-ray techs are all about.
Correct.
Although that's what the patient sees.
Yes.
That's not really what X-ray techs are all about. You have to understand how that machine actually works and how it's going to penetrate the tissues to get the view that you're looking for.
Yes, ma'am.
So that's very, very interesting. Do you feel like being a CNA has helped in that role as an X-ray tech?
I don't really see that is kind of helpful. It's just, I think is more helpful when you're motivated to care for individuals.
Oh, so you've got that patient care background.
Yes.
Okay.
So if you don't like or have the passion to help others or anything like that, then I think you will have to have that first.
Sure, absolutely.
And you have to have patience and everything.
So you're able to use those skills that you've cultivated as a CNA and the compassion and integrity and just the caring part.
Yes.
Because just putting a patient in a position for an X-ray that's the technical part of it. But if they don't, they're probably scared.
Yes. And be in pain and everything.
Right.
And they'll be yelling at you and you'll be like, if you snap back at them, it's not right. So you have to have the patience and work with them.
So it's all about the patient, not about us.
Yes.
That's a great way to look at it. Very good. Well, you've got some really great experiences and some great insight as well. And what is some advice that you would give to somebody that is working in healthcare and maybe thinking about taking an X-ray tech class or another certification class to add to their medical knowledge? What's some advice that you would give to them?
I'll always say have support beside your side. If not, kind of be your own motivator. Pretty much ask around people that are in the field. Ask how they got there. Ask what was their struggles. Ask everything you can ask about that if you need to.
Right.
Because people that have been in it for years will tell you the ins and outs of whatever profession that is in the health field.
That's great advice. Make friends wherever you go and find out about what they do, because there may be a career there that's just right for you.
Yes.
That you don't even know about yet.
Yes.
So great advice. Well, thank you for stopping in with us today and explaining to us what you do and the settings that you work in. We really appreciate your time.
You're welcome.
Well, thank you very much for your CNA fans for joining us. Make sure if you like this video, you give us a thumbs up, subscribe to our channel, and hit the bell for notifications, and YouTube will let you know when we have a new video posted. Tune in for our other weekly series, Motivation Monday, Test Tip Tuesday, Workplace Wednesday, Newsflash Thursday, Fashion Friday, and Career Spotlight Saturday. We hope to see you at each one. If you have any comments, please leave them below. We'd love to listen to what you have to say, and if you have any suggestions for upcoming episodes, we'd love to hear that as well. Until next time, happy nursing!